This is Dr. Karib. She's from Manitoba, long way. End of our 2-day ozone workshop. Comments on our workshop, Dr. Aseel?
This is amazing workshop. This is my first workshop for ozone. It changed my mind about how to practice medicine. We are in the wrong job. This is something everybody should learn about it, and it can help a lot of people, and it doesn't cause them a lot of side effects. So I'm amazed with what I saw.
I'm delighted that you said that. Thank you. It was worth the time and the cost and everything.
Definitely.
And you would recommend this to other doctors?
Yes, to other doctor. And I will explain it to my colleague, and I will convince them to start doing that in our clinic.
Do you really think you can convince other doctors that what you saw is real?
Couple of them maybe.
Maybe.
Yeah.
Okay, may I post you?
Yes.
Thank you very much.
Thanks.
This is Dr. Matheson. Today's May 14th, 2022, end of our workshop. Comments?
Yeah. Fabulous workshop. So much incredible information. The hands-on experience was very, very positive. A little overwhelming at moments with so much amazing information at once, but definitely a really good experience. And what a great crew to train and practice with.
You'd recommend it to other doctors?
I would recommend it. If you want to learn about ozone and injections and all that good stuff, I would highly recommend.
Thank you very much. Can I post you?
Absolutely.
Good. This is Dr. Yuri. This is May 14th. This is the end of our basic 2-day ozone workshop. Dr. Yuri, comments on the workshop?
A lot of information, great information, hands-on practice with just about everything. Saw a lot of things change. Had my knee injected. Pain went away instantly. Still feels great, and it's the next day. So overall, very happy, and yeah, glad to be here.
It was worth it?
Oh yeah, definitely worth it.
Worth the price?
I didn't pay the price, so to me, definitely 100% worth it.
Okay, would you recommend it to others?
Oh, most definitely.
Okay, did you see things here that surprised you?
Yes, a lot of things.
Okay.
A lot of surprises.
Okay. Does it change your life and your attitude towards the kind of work you'll do?
Oh yeah.
All right.
And the kind of work I've been doing and
Very
gonna
good.
keep doing.
Thank you. May I post you on YouTube?
Most definitely.
Thank you.
Okay.
Okay, go ahead.
This was a completely amazing training this weekend, and I learned a lot. Especially, I have been using major autohemotherapy, different method, and gravity method. I will not be using that method anymore. I will now be using DIV and hyperbaric.
Hyperbaric ozone.
Hyperbaric
You're a
ozone.
medical doctor?
I'm a naturopathic doctor
Naturopathic doctor. And where?
in Sacramento.
Okay. And was the workshop worth it?
It was definitely worth it. Yes, I recommend anybody take it who's practicing with ozone, or not even practicing ozone, but would love to treat patients more effectively.
Would you have believed what you saw amongst the participants and the patients if you hadn't have seen it?
No, I would not have believed it. Yeah.
Thank you.
Yes.
May I post you?
Yes.
Thank you. This is Dr. Chosel. This is the end of our basic 2-day workshop. Comments on the workshop?
I thought it was amazing. I liked learning about all the different types of ozone, especially hyperbaric ozone and DIV. And I definitely would recommend it to anybody who's interested in treating patients more effectively.
What were your thoughts on what you saw with the results yesterday with the local injections?
That was amazing. I need to definitely practice because I want to bring that into the practice.
And would you have believed it if you didn't see it?
No, I don't think so.
It would be impossible to
yeah.
believe.
You gotta come.
Yeah, thank you. May I post you?
Of course.
This is Dr. Marie, a physician, and you're a nurse practitioner, excuse me. And you practice in Southern California? No, you practice in the Northeast.
No, in New York.
Yeah, so you've come a long way. What are your comments on our workshop?
I truly appreciate the way that you guys taught this class. I learned a lot, and I truly feel that it opens my world to it's like a brand new world out there. I didn't know that ozone was, people were able to do so many things with ozone. It truly amazed me.
It was worth the trip coming here?
Definitely.
And the cost?
Definitely.
Definitely. Thank
and
you.
I'm looking forward to use it for now, people that are close to me, and then I'll venture out to other people.
Were you surprised by the results of what you saw yesterday, the instant local injections?
Definitely.
That would be hard to believe.
Yeah, if I didn't see it, I wouldn't believe it.
Thank you. May I post you?
Sure.
Thank you. This is nurse practitioner Nicole from
Kroll
where?
from Texas.
From Texas. So you've come a long way.
Yeah.
And what were your thoughts on the workshop?
It's been amazing. It's I'm gonna tell you that I've seen things that I would never have thought happened before. I'm really, really excited to be here and to be learning all these innovative practices with Ozone.
Worth the cost?
Definitely.
And worth the time coming?
For sure.
And you'd recommend this to other professionals?
I would definitely recommend this. In fact, I may do it again just to make sure that I don't forget anything.
We have a lot of people do that. Last question. You saw local injections yesterday and the results.
Yes.
Comments on that?
I had an injection in my SI joint. Before I got the injection, I had a lot of pain in my right SI joint. I had several massages and things before I got here because I was worried that I wouldn't be able to carry my suitcase. I did make it, but it was a little bit rough. I wasn't able to bend down and tie my shoes and things like that, so I was having to kind of...
And you got the injection?
I got the injection, and yesterday, immediately after the injection, I could bend over. Today, I was a little bit stiff, but no pain. Everything seems to be good. I've been standing pretty much all day long, and I've not had any issues.
Thank you very much. May I post you?
Certainly.
Thank you. This is Michael. This is the end of our workshop, 2-day workshop. We have one day more. And Michael is a layman, but he's a very special layman. He is helping to get set up a clinic like ours, Ozone Oxidation. It's the Sacramento area. We won't get into the personal reasons why he's doing it, but it's not financial. Michael, comments on what you have seen from me in this clinic in every way and in this workshop, please.
Yeah, so I think the best way for me to answer this question is actually from a personal and a heartfelt perspective. My wife did pass away from COVID, and she passed away from COVID because 3 different physicians refused to administer care to her. The first physician refused to administer monoclonal antibodies. The second physician refused to administer IV vitamin C. And the third physician refused to administer major autohemotherapy. All 3 modalities could have saved her life. So I'm here to, first of all, say thank you to Dr. Rowan, because he was the first person that I met with who educated me on what was possible for treating COVID patients. And secondly, to say that this is actually my second time attending this seminar. The first time I attended it as a volunteer, and I had the opportunity to interview all the physicians that had attended, just like I did this time. And I don't think that you can overestimate the value of this seminar, not just based upon the knowledge and the value of the treatment, but also because of the quality of people you're going to have the opportunity to interact with and learn from. And there's a true community here. And unfortunately, physician-related deaths has become the second leading cause of death in the United States, and we're trending towards number 1. And in the midst of all of that, we have people like Dr. Rowan, Dr. Robbins, Dr. Rowan's wife, Dr. Terry Sue, who are doing anything and everything they can to embody what it truly means to be a healer and a physician. And on behalf of myself and every other patient that you have treated and have yet to treat, all I have to say is a very deep and heartfelt thank you.
Michael, that was really kind of you, your words, and especially your personal matter, which I chose not to bring up.
I appreciate that. You've
been here a lot. You've seen patients.
Yeah.
If you hadn't have been here to actually see it, could you have believed what comes out of here?
No. Honestly, we were just having that conversation, myself and 3 other physicians and the nurse that came with us. It's really been a phenomenal experience to interact with you. Our physician, Dr. Del Pozo, was just remarking upon how we had one patient who had an infected knee that was so badly infected And she's a hospitalist who works in the ICU, worked in 3 different hospitals throughout the pandemic. And she said she typically would have referred him to the emergency room for IV antibiotics. Instead, what she did was she treated him 2 days consecutively with ozone injections. On the 3rd day, he was supposed to come back for treatment, and he missed the appointment, and she called him to say, "Where the hell are you?" And he said, "I'm on the tennis court. I'm doing just fine." So all I can say is that in addition to the remarkable things that I've seen here, not just at this seminar, but in my multiple visits to the clinic, I've seen Lyme patients get ozone dialysis that I never thought could have tolerated it. I've seen Parkinson's patients improve.
That's here.
That's here.
That's here, yes.
That's here. I'm sorry. Just to be clear, this is all here at Dr. Rowan's clinic. And some severely ill patients get better. And these patients, in my opinion, just based upon my limited knowledge, as well as the fact that these patients communicated to me just how many physicians they had sought treatment from prior to arriving here, watching them get better is, I'm not going to use the word miracle because I think that word gets overused and loses its specialness. But when you see what's really capable with not just quality medicine, but quality people utilizing that quality medicine, then yeah, you really do get miracles sometimes.
Thank you very much. And again, I have your permission to post this.
1,000,000%.
Thank you.
Just wanted to add something, that he is a very honorable man. He took his time, his patience, to go over all the important information. And he's not a person that looks to make money. He's more for the well-being of the person that he's treating. And that really melt my heart.
Thank you for that personal comment. I really appreciate it. Today's May 16th. This is the end of our dialysis workshop. This is Dr. Cochran from Washington. How did you enjoy today's dialysis class?
I thought it was really well done. We definitely started out with an intro, an overview of the actual mechanism, how to set everything up, and I thought there was a lot of instructors so we could break out into small groups and each of us could do it and also have a treatment be received.
And you're an ozone doctor.
I am.
You do a lot of ozone.
I do a
right?
lot of ozone, and I also teach other doctors how to do ozone.
Okay.
Yeah.
And today was worthwhile to you.
Definitely worthwhile to add on.
And the cost.
Yep.
Very good. Thank you. May I post this on YouTube?
Yes, you can.
Thanks. Today's May 16th. This is the end of our 3-day workshop. This is Dr. Baltimore, who came for the dialysis portion. Comments from you, Dr. Baltimore.
Once again, I think you have accelerated ozone therapy beyond measure at this level. It's amazing what you can achieve with this type of therapy. And having done 10 PASS for the last 7 years and major autohemotherapy since the late 80s, again, it's just astounding the kind of advancement that you've come up with each time. And so I'm thrilled.
Where do you practice?
I'm in Connecticut.
So you came a long way
Always.
just for this.
Always.
Gosh,
Yeah.
I'm really honored.
Oh, I'm honored to learn from you.
So it was worth the cost.
Absolutely. Absolutely.
And you'd recommend it to others.
Always. I recommend you to everybody that I see.
Thank you so much. I may
My
post this.
pleasure. Sorry?
I may post this.
Absolutely.
Thank you.
Thank you.
Today is May 16th, the end of our dialysis workshop. This is Dr. David, who came from Canada, BC, and you came for our dialysis class. Any comments on the class?
Well, I find it really informative. I find it really innovative, and I find it really incredible for the benefit for the patient. So I've been doing ozone therapy for a long time, and this is pretty much the new technology that we can take advantage of for benefit of patients. So I find it really incredible.
Thank you. It was worth it to come?
Absolutely. Yeah, no, I'll come back.
You'll come back. Oh,
Absolutely.
wonderful. Thank you. You missed the 2-day class.
Well, in that dose, I have a little experience, so this is why I didn't take it. Yeah. But this one is really new for me, and it's really amazing. I was just waiting for this to come. Understood. So I really appreciate that you guys bring it up.
Worth the cost?
Absolutely. Every penny.
Thank you so much. May I post this?
Absolutely. You have my permission, and it's my pleasure to be with you guys here.
Thank you. It's my honor that you're here.
Thank you, Doc.
Today is May 16th, 2022. This is the internationally famous Dr. Howard Robbins, one of the world's experts in ozone therapy, who does a lot of DIV, direct intravenous gas ozone. And he's published, and he's quite famous for it, and is an instructor. And he came, this video is going to be divided up into a few parts. One on the workshop that he just attended, and 2 on the treatments that he got. So let's first talk about the ozone workshop. You've been out here several times, and you attended all 3 days this weekend, 2 days of general ozone, and the 3rd day today of dialysis. Any comments on our workshops and what you get out of it, because you're an expert?
Well, I also do the hyperbaric high-dose ozone with multi-pass, the 10-pass. It hasn't been one time that I've come here, honestly, that I didn't learn something new. A little tweak that makes it easier or more effective. And this time was no exception. I watch all the doctors, and they get everything they need out of it, so that when they're done, they can go home and start doing the treatments. They feel confident in the training that they received, and we have a wonderful time. That's nothing less than that. Everybody enjoys themselves. It's not just work, but it's have fun at the same time that you're learning.
The doctors seem to really like it. You get that feeling?
They not just like it, they feel it was worth the time, the effort, and more importantly, even the money that they spent to come here and do the workshops.
Okay, thank you very much. Now, the next part of this video, and in case I split it up, I'll put the date in again, May 16th, 2022. You come out here and you, during the workshops, you get injections from me. And we can talk frankly on this, can we not?
Absolutely.
We have given you low back injections and prostate injections. What's it done for your low back? What have we done, and what's it done for your low back?
Well, I've suffered from 18 years of playing judo with low back pain chronically, and by getting regular chiropractic and coming here for the L4, L5, the SI joints, I've had amazing relief. It is very rare that I have pain or I suffer at all, except when weather changes a little bit. So there is little doubt in my mind the difference this has made, because my back can't be getting easily better without them. And I do believe it's improved with them.
And do you have anatomic disc disease or anatomic degeneration in your lumbar spine?
Without a doubt, I have it. And I know it has to have been either repairing it or slowing down the degeneration.
So obviously, this is a recommendation you give to other people with sacroiliac and lumbar spine problems.
Absolutely. Now, I do the same injections on patients myself. I just can't inject myself.
Okay.
And I get wonderful, absolutely wonderful results. Well, with back injections, well into the high 80 percentile of complete success.
And you learned all this stuff here, didn't you?
I learned everything I know about prolo ozone therapy from Dr. Rowan. And when I've seen other doctors who have done other trainings in it, they have learned and told and communicated with me that these techniques that they're learning here are superior. So you can do things many different ways, but the techniques you're getting here seem to be not only advantageous, but superior to other methods of doing it.
Thank you. And finally, again, in case I split this up, it's still May 16th, 2022. We've done your prostate. and you come and ask me to do your prostate every time you come out here. And this time you were here for 4 days and you asked me to do it twice during your 4 days. And I've done it. I just got done a treatment on you now. Do you want to comment on the injection, the technique, the discomfort, lack of discomfort, and what it's done for you?
Okay, so first of all, I've been suffering from BPH, benign prostatic hyperplasia, enlarged prostate, for quite a number of years now. And my grandfather got prostate cancer, one of my grandfathers, and actually passed away from complications from it. So I have a concern there, to say the least. Each time that I've come, one of the problems I have in the morning is urination. First time I get up in the morning to go to urinate, it's very difficult, and it doesn't come out smooth or easy at all, sort of drip, drip, drip. And then as I walk around, it eases up, and I guess swelling comes down, and I urinate well. Right after these injections, I wake up in the morning, and first urination is simple and easy. And this time, interestingly enough, I noticed that erection happened while I was in bed in the morning before I got up. And I haven't had that happen in a long time. I'm 74 years old, and it doesn't happen when you get to this age easily or readily. So that's something I've noticed that's made a big difference. And since I'm generally not here long enough to separate the injections by a few days, I've only dealt with one. This time I was able to get two, and I'll know how that how much more effective it is in terms of its anti-inflammatory effect and shrinking of the prostate in the next day or so.
Was it uncomfortable?
Oh, that's an interesting thing. One would think that it would be extremely painful. You barely even feel the needle stick, which is unusual because you would have expected at least the needle stick would be painful. You barely even feel the needle stick. You feel absolutely no pressure, no discomfort. It is just a very simple, rather rapid injection, and there's virtually no discomfort whatsoever. Don't be afraid of it. Be thankful that it can be done, and the way Dr. Rowan does it is extremely, extremely comfortable, and it seems effective as well.
Thank you, Dr. Robbins. May I post this on YouTube?
You certainly may.
Thanks. And for the viewer, Dr. Robbins is an instructor in his own right. He teaches direct intravenous gas.
The only problem is I can't shoot my own prostate. I've never seen one done.
That's right. Your eyes are on the other end. Thank you, Howard.